to present the bad debt write-off, Mrs. Candy York.
Yes, ma'am. Good evening. On page 6 of your packet, you have the request to write off delinquent accounts as of March 31st, 2021 in the amount of $22,704.41. As of December 31st, 2020, the accounts referenced above are 90 days old or older. We have sent the notifications to the consumers that their accounts will be turned over to the North Carolina Debt Set-Off Program, and the totals represented on this write-off have not responded. So we're requesting a motion to approve the write-off.
I'll make the motion we approve the write-off.
A second.
Dr. Ojo, if you're speaking, we can't hear you anymore. Dr. Ojo, we lost your sound. Are you able to call in so we can get your audio back? I will try it. Dr. Ojo, we'll have Kelly give you the call-in number. And as a reminder, if you are not speaking, please make sure you mute your phone. Thank you. And Dr. Ojo, if you're okay with it, if you'll give me a thumbs up, I will take the motion. If we get a thumbs up that you can hear me say that, maybe. I'll hand it back over to you once we're ready. Okay, give us 1 second. Can y'all, can someone give me a call? Let me know that you can hear me. Okay, y'all. Okay. Okay, we're going to work with Dr. Ojo offline to get her set up. So I'll entertain a motion.
Please enter your audio PIN followed by the pound or hash sign. If you do not have a PIN, just press pound or hash.
I am so sorry.
Can you hear me now? Can you all hear me?
Yes, ma'am. Yes, we can hear you now. Yes, ma'am.
Okay, thank you very much. I'm sorry about that. I'm not sure what's going on with my computer. I'm sorry, I got cut off. Did Miss Candy York present the bad debt write-off?
Yes, ma'am. There is a motion and a second, and we just need the vote.
Okay. Do we have any comments or questions? May I have the motion to please approve the bad debt write-off?
There's a motion and a second on the floor already. We just need the vote.
Okay. The vote on which one are you? Where are you?
They're on the bad debt write-off. We have a motion and a second on the floor. So we're ready if you're ready for a vote amongst the board.
So all in favor?
Aye.
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 Thank you very much. Thank you. Please, I'm sorry about the disruption. Please reference page 7 on your packet. Sunday, May 16, 2021 is No Mental Sunday. And this is a national annual event where the faith community and their allies help spread awareness of the impact of tobacco on Black health. They provide support to those trying to quit, and they raise awareness on issues related to mental. I welcome Mr. Travis Greer to please expatiate on the proclamation for the board's approval. Mr. Travis Greer.
Hey, good evening, Board of Health, and I am Travis Greer, the Regional Tobacco Prevention and Control Manager, so thanks for having me on here today. So, as you know, here's a quote for today if you haven't had it already. A Sunday well spent brings a week of content. And if you can't tell, one of my favorite days of the week is obviously Sunday. Sunday for me, that means faith, family, sometimes football, and definitely rest. So what does Sunday mean for you? And Dr. Ojo, as you mentioned, for the Center for Black Health and Equity, which is a national organization based out of Durham, North Carolina, the third Sunday of each year in May means No Menthol Sunday for them and also for faith communities. So here at the Public Health Department, along with myself as Tobacco Control Manager and the Health Education Unit, I see Tamara Morris, Health Educators, on the line as well. We've kind of developed a pretty decent plan of action to bolster this day across our county and our community to encourage faith leaders and engage with them to get involved. So how can the Board of Health get involved? Obviously, you see this proclamation before you in your packets, and I can read through that real quick, then we'll take consideration discussions and vote for that. So whereas the Cumberland County Board of Health proudly joins the Center for Black Health and Equity, faith leaders, and community advocates in celebrating No Menthol Sunday on May 16th, 2021. And whereas No Menthol Sunday is a national observance day led by the Center for Black Health and Equity and is also supported by our North Carolina Department of Public Health and Human Services Department. So whereas No Menthol Sunday emphasizes the role that menthol plays in quitting tobacco while addressing the social, economic, and governmental systems that perpetuate the high rates of tobacco use across groups defined by race, ethnicity, education level, and also socioeconomic status. And whereas the majority of African Americans who smoke use menthol cigarettes. Secondly, 7 out of 10 African Americans, youth ages 12 to 17 who smoke use menthol cigarettes as well. 93% of Black adults who smoke started smoking by using menthol cigarettes compared to 44% of white adults who smoke. So whereas No Menthol Sunday acknowledges that tobacco use is a major contributor to the 3 leading causes of death among African Americans, and also that vaping and smoking can weaken the immune system and put individuals at high risk of severe illness or death from COVID-19 as well. So whereas No Menthol Sunday highlights the importance of congregations, young and old adults and youth, right, to be informed of current issues related to tobacco use and prevention, with the theme of this year of No Menthol Sunday 2021, A New Day. Whereas No Menthol Sunday recognizes people of faith and the instrumental role they play in creating and supporting those who want to quit by letting them know that they are not alone. Finally, whereas quitting tobacco is the best thing a person can do for their health, therefore, the Cumberland County Department of Public Health stands ready to offer its support to the community to quit tobacco for good. Now, therefore, be it resolved, the Cumberland County Board of Health proclaims Sunday, May 16th, 2021 to be No Menthol Sunday in Cumberland County. So I welcome any discussions or any motions to adopt this proclamation to celebrate this day coming up.
Thank you very, very much, Mr. Travis Greer. Any comments, questions on the proclamation, please? Do we have any questions for Mr. Greer? Any comments?
Yes, this is Dr. Kearney. I have a question. How is this being marketed or communicated out to the community?
Mm-hmm. Yep, we work within our health department, PIO department, and we'll be soon sending out information via our Facebook page. And Dr. Green and Ashley Curtis, they've got us lined up to communicate with the Pastors Council and to maybe discuss this on WIDU radio station. And just, I know Tamara and the Health Education Union, they've got faith community partners in their listservs, and so they're pushing it out that way as well. And promoting the toolkit that they have online at nomentholsunday.org as well. So that's part of our marketing plan. And one other thing that plan we hope to do on our Cumberland County TV network to be showing that week of No Menthol Sunday a few documentaries surrounding the issues and the history of how menthol has been a negative effect on tobacco use, especially among African Americans. And we'll be putting that information out to the public through PSAs and social media as well.
That's really good. That's really good approach with multiple different opportunities for others to learn about it. I think it's really great.
I think so too. Thank you very much. Any more comments, please? Thank you. May I please have the motion to approve the proclamation?
Okay, motion to approve.
Thank you. Second,
I second to approve.
all in favor?
Aye.
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 Thank you very much. Moving on to item 3 on the agenda. The floor is open for public comment, please. Do we have any public members?
We do not have any members of the public here for public comment.
Thank you. At this point, we will close the floor for public comment and call on Mrs. Candy York to please present the financial report. Mrs. Candy York.
Yes, ma'am. Again, on page 8 of your packet, you have the statement of revenues and expenditures at the close of month of March 31st, 2021. At the close of the month, our revenues exceeded our expenditures by $511,127. On page 9, you have the expenditures broken down by program. Page 10 begins a revenue report, which reflects your state and federal allocations and our grant revenue. On page 11 is the Medicaid, the fee collection, the fund balance that has been appropriated, and the money that have been allocated. We have the accounts receivable report, broken down by payer source and program. And finally, on page 13, we have the aging report, accounts receivable, broken down by program and aging. And I'll answer any questions there may be about any of the reports provided.
Thank you, Mrs. York.
Thank you.
Any comment, question for Mrs. York? Please. I will now call on Dr. Jennifer Green to please present the external report and the director's update. Thank you, Dr. Green.
Good evening, everyone. In your packet, you have the WIC audit for 2021. My arrival started with the tradition of making sure that when we receive external reports from either the state or other grantors, that we share those findings in the interest of transparency. So today we have our 2021 WIC audit, and this is our self-assessment review and the corrective action plan for our deficiencies. And this is, there are a large number of areas in which we are on. There's more than 16 different areas in which we have findings. which we have to review. And so on the 2-page report, on the first page, you can see that there are 2 corrective actions in the application process and transfers. There's 1 corrective action for a nutrition assessment. And on the second page, there are 4 corrective actions, 1 related to a nutrition plan of care, and 2 related to nutrition education. All of those will be completed and corrected in our record review in June 2021. And overall, this is a really strong report, and because there's a lot of areas to review, so to have just this few number of corrective items is a really strong review. So much appreciation to our WIC team for their work in making sure that we have a good site visit with our team. And then we'll pull up slides for our director's report. And we're going to get those up. Thank you, Danny. So we'll start out with, I'm going a little bit out of order here, if that's okay. We'll start out with a review of our regional community health assessment and tell you where we are with that data. So as we mentioned during our last Board of Health meeting, it is time for our community health assessment. And as we mentioned in the timeline last month, between the month of March and April, we'll get secondary data from the state health department. So we began to receive that, and that was our Healthy North Carolina 2030 indicators. So that county level data, we received that information from the state. And remember, this is a part of North Carolina's Healthy People 2030 initiative. And if you need that link again, we can send that out to you with the overall state report. In addition, according to our timeline between the months of March and May, we will begin distribution of our community survey. So we have the survey available now in English and in Spanish. We are beginning to launch our campaign efforts to get folks to take that survey. We will have hard copies at the health department, as well as our vaccination sites and as well as our libraries. We'll have palm cards and flyers and then push this out on social media as well. We will have a press release going out very soon. In addition, our health education staff are working to do 2 focus groups. One focus group will work with students and get their unique perspective and get some more nuanced information maybe that we don't capture on a survey. And then this year we're really excited because we're going to do a second focus group all in Spanish with some of our Hispanic members of our community to make sure we get that focus as well. So we will have, those will both be virtual, and we're recruiting participants on both of those focus groups now. In addition, we're working, we'll have radio interviews to promote the survey. Our friends at WIDU always welcome us to come talk about the CHA. And then in addition, our Cape Fear Valley Hospital is also helping us to promote the survey. So the survey is live now. And as there's another assessment, Fort Bragg's community health assessment is wrapping up this week. And so then we will really begin to push this survey as well. And not to put you on the spot, Ashley, but if you know how many surveys we've already done, I want to say we already have about 200 surveys done, and we will continue collecting through mid-June before we turn that data back over to the state for assessment. So are there any questions about the health assessment? As part of that, one of the data points that will go into that regional community health assessment, that secondary data, are our 2020 county health rankings. So that data was just released, and we will have a more in-depth dive with the Board of Health next month on our county health rankings, but I just wanted to bring it to your attention that that data was released. They switched up the rankings just a little bit this year. And so such that the focus is really not necessarily on your ranking, but on how you are performing overall. And so they, as a reminder for our county health rankings, were ranked in 2 big broad categories. One in terms of health outcomes, and then second in terms of health factors. So for Cumberland County, we're ranked in the lower middle range of counties in North Carolina for health outcomes. And then for health factors, we're also ranked in the lower middle range. Overall, we're ranked 55 out of the 100 counties. So that for us is an improvement. Last year, I believe we were ranked 69. So we've made it, we've jumped several spots. And these county health rankings are based off a number of factors. Our overall premature death rate, adult smoking, as you heard Travis talk about, adult obesity that links in, for example, with our Healthiest Cities and Counties grant, low birth weight, mental health days, physical health, mental health, and then some other factors that are a bit outside of the scope of the health department. For example, the number of children in poverty or a high school graduation rate. So it's really a comprehensive look. And of course, public health can impact all of those things, but we also know that we cannot do that work in improving our rankings alone. So we'll have a deeper dive and a look into that in a future meeting, but I just wanted to put that on your radar that that is available now. The next item on our agenda, I want to give a report out from our health directors meeting. Last week, or almost 2 weeks ago now, we had our annual health directors legal conference. And one of the components of that legal conference was to review some of the legislative updates that are going on in Raleigh right now. We get a bill tracker from our state association on a almost weekly basis about what bills are in the House and what bills are in the Senate and bills to watch. So we won't go over all of them, but just a few to draw your attention to. There are a couple of bills actually in the House and in the Senate that would add school nurses to schools. One bill would proposes to add a school nurse funding so that there'll be a school nurse in every school, and another just adds to the overall number. So both of those have some bipartisan support, but of course it has to go through the budget process before, and of course through the House and the Senate, and then to the governor, and then through a budget process. So it may not come out that way, but we're keeping an eye on those bills. There's a bill in the House that would support local communicable disease programs and funding. It would provide us $36 million annually to local health departments. 18 million of that would be divided among counties based on the number of counties that health department serves. So for example, our district health departments would get some more dollars because they serve more counties. And then the other half, the other 18 million, would get divided out among health departments based on the population size, or based on our county's population size and the percentage. So that bill also has some bipartisan support. So that would obviously be a good thing for the health department to bring some local communicable disease funding. This is a bill that the state association strongly supports because it brings dollars, much needed dollars, to our communicable disease department, and funding has been fairly flat in that department for several years now. There's a bill also, the North Carolina Omnibus Act, which would allow grants to eligible entities to specifically prevent maternal mortality and maternal morbidity, particularly among Black women. So that is a bill that is new, but we're keeping an eye on it as well. There's a couple other bills on the next slide about Medicaid expansion. So, of course, with the American Recovery Act, there is some incentives for our state to expand Medicaid. And then there's an additional bill which would expand Medicaid for up to 12 months postpartum. And that coverage would begin April the 1st, 2022. And actually, as a piece of that bill, it would waive tuition and fees at North Carolina community colleges. So those are all bills that we're also paying attention to and watching. And if you're interested, we can send you the link to the text of those bills as well. A brief update about our Healthiest Cities and Counties grant. If you recall, we got this grant. We were awarded this grant last year in July. So almost a year in, and the goals of this grant was really to address food insecurity and access to healthy foods in Cumberland County and Fort Bragg. And two, the grant really focused on two different approaches. One, to conduct a food system assessment of our county and to determine what are the areas of strengths that we have and what are the areas that we need to work on. So that piece of the project is underway. And we're working again with UNC on that portion of the project to conduct the food system assessment. The second part of the project was to establish a joint county installation, Fort Bragg, a food policy council. And we think that this will be the first of its kind between a military installation and a county in the country. There are many food policy councils, but none, and that would be set up quite this way. And the purpose of that food policy council would be to really think about increasing access to healthy foods, identifying and recognizing and recommending policy changes. So not just handing out food, but thinking about upstream factors. What are the things that we need to do to address policy that would help improve food access? Making sure we're leading with equity in mind, and thinking about who has access and who doesn't have access to healthy foods. And then specifically to communicate with food system partners across the spectrum to have a better sense of and better collaboration across food system partners. So everybody from the farmer to the grocery store worker to the consumer, and really make sure that we are having a strong food system. The third, or another portion of the Food Policy Council will be working with the statewide Community Food Strategies Network and other existing food policy councils around the state to make sure that we are not duplicating efforts, and of course partners locally, but to learn best practices. And then finally to explore ways to think about local resources and conserving those local resources, whether that's livestock or soil, water, air. And the Food Policy Council would work together with members from Fort Bragg and members from the county, representatives from the public, of course, to advance these goals. And they would use the results of the food policy assessment to identify strategies to work on. So taking that data-driven approach. We're working to have that approved during a May county commission meeting and to establish the council through the county commissioner. So we hope to do that here in the next couple of weeks. And then after that, we will have an application process open and available to the public so that they can apply to be members of the Food Policy Council with meetings starting later in the year. So I'll pause there to see if there are any questions about the Food Policy Council. All right, hearing none, we will move to our COVID-19 updates. So there's quite a bit going on with COVID right now. We'll start with the numbers as usual. So currently we have 27,626 cases. That was as of, these slides were originally from last week, but I updated them today. So last updated this morning. In the last 7 days, we've seen more cases than we have in the previous 14 days. So that's concerning to us. We're starting to see this slow uptick in the number of cases that we have. We had seen a reversal of those trends, really positive movement, but now it's starting to move in a direction that we are concerned about. So in the most recent 7 days, we've had 585 cases, and then in the last 14 days, 1046. Our case positivity rate has also ticked up just a bit over time. I think last meeting we were somewhere in the 7s, and now we're back up to 8%. And then our number of deaths has actually been fairly level. We have 298 deaths. Our county, according to the county alert system, is in the yellow, the darker yellow, which still means significant impact on our community, but much improved from where we were back during the last meeting and even back in earlier in the winter. So we have some work to do here, and we're keeping a close eye on those numbers. In terms of testing, on the next slide, this chart shows week over week. You guys are familiar with the number of tests that are performed countywide. So you can see that we've seen a drop off in the number of folks getting tested, which of course impacts our case positivity rate over time. Our testing really peaked, not surprisingly, around the holiday season in December and early January, and it really has dropped off since then. But we have more testing sites than we had in the past in January and December. And actually, we have some new testing sites that are getting launched by the health department. As you'll recall, we suspended our test sites back in December to shift so we can make sure we got vaccines in arms, but we still maintained our work with our state health department vendor to launch new test sites. So on the next slide, we've got 3 new test sites. Our vendor that works in Cumberland County is OptumServe. They operate without an appointment. You can make one, but not required. So there are vaccine or appointments available for testing on Monday through Friday. So on Mondays, Wednesdays, and Fridays, beginning, I believe, later this month, we'll be at Fayetteville Avenue Church on Rose Hill Road. We'll be back at Manor Church. We had a temporary pause there, but we'll be back at Manor Church on May 25th on Tuesdays. Through May 25th. And then on Tuesdays and Thursdays, at Beauty Spot through May 27th. So we actually, again, we have more testing sites than we did previously, but we've just seen a decreasing demand for testing as well. So as a reminder for the public, we want people to continue to get tested if you've been exposed or you're symptomatic. So we make sure that we get those trends in a positive direction. So let's talk a little bit about vaccinations. I included this slide as just a little bit of a comparison. Statewide and nationally, we are seeing that right now, young people between the ages of 18 and 49, but particularly those under the age of 30, are really driving our case count right now. In Cumberland County, they make up about 62% of our cases. And that makes sense because our young people, our daycare workers, our teachers, they're the ones that are essential workers that may be exposed more than some of our other individuals, and are really kind of behind some of the increases in cases right now. And as we have our young people, as our older folks are getting vaccinated, those that are over the age of 65, we've seen a drop off in those cases. So if you look at the very bottom, in the green, that is where our 65 and our 75-year-olds are. And you can see that those lines are almost disappeared in terms of our cases. And our young people are in the purple and then in that darker brown reddish color. So we really need to do some work among our young people to get them vaccinated. On the flip side of that, we have seen partly because they became eligible later than some of our older adults, but our young people have not been vaccinated at the rates that we would like for them to be. I pulled these slides, this data last week, but we haven't seen much movement. So on the right-hand side, you can see the percentage of the population in Cumberland County that's been vaccinated by age. And so that dark green line at the top and the darker blue line are our 65-year-old and then our 75-year-old group. And about 2/3 of our 65 to 74-year-olds and about 2/3 of our 75 plus have been vaccinated. So they're doing a great job in coming out and getting vaccinated. Our younger folks, among our 18 to 24-year-olds, only about 7.2, I think right now, about 8% of our 18 to 24-year-olds are vaccinated, and then only about 14 or 15% of our 25 to 49-year-olds. So we have some work to do with our young people, and we'd encourage them to get vaccinated. So before we jump back to vaccines, I want to give a quick J&J update and what we have learned over the last couple of days from the state. So we were on a call this afternoon with some of the partners from the CDC to get a healthcare update and what the findings of Johnson & Johnson were. So overall, 7.98, almost 8 million doses of J&J have been administered. And out of those, there are 15 confirmed cases of what we call TTS syndrome, or thrombosis with thrombocytopenia syndrome, TTS. And all of those cases, or the majority of those cases, are among young women, so 18 to 49-year-old women. and then 50-year-old women. So out of the 15 cases, 13 of those cases were among women between the ages of 18 to 49. And so the case rate for that is 7.0 per a million. And then for 50-year-olds and plus females, there were 2 cases. And so that's less than 1 per a million in terms of a case rate. There were no cases that they found that met the definition and the criteria among males. So last week, so 2 consecutive Fridays, the advisory committee to the CDC met, and they determined ultimately that the risk of the J&J vaccine ultimately outweighed the benefit. We expect, and the advisory committee expects, that we will see additional doses or cases of TTS. However, depending on overall vaccine uptake and the amount of transmission that are in the community, they made some pretty strong estimates about how many deaths will be prevented and how many hospital admissions will be prevented. And the number of deaths that will prevent from providing J&J and the number of deaths that will prevent in their assessment outweighed the risks. So what they ultimately decided to do and voted, as you probably have heard over the weekend, was to make sure to recommend continuing the J&J update. So on the next slide, we'll talk a little bit more about that. So they recommended that J&J can be continued to administer for anybody that's over the age of 18 in the United States. The FDA also decided to add a warning to the J&J vaccine, including on our fact sheet. So every person that gets a dose of COVID vaccine gets what we call a EUA fact sheet, and it just gives information, the patient information about the vaccines, the risks, the benefits, things to look for, their side effects, making sure that they're aware of what they're actually getting. And so this warning was added to those fact sheets. And we will follow our state health department guidance and the guidance of the CDC, and we will continue and resume our administration. Before the pause, we administered J&J for 1 day, and then the pause happened. So we do have some J&J on hand and in supply. And as we get those updated fact sheets from the CDC, we will resume our administration of J&J, but we want to make sure that we got our paperwork together and have all the information available for patients first. So we're working on getting that updated this week. The advisory committee also said that women under the age of 50 can receive any of the FDA authorized vaccines, meaning Pfizer or Moderna, and they may want to receive one of those, but they can also receive J&J. But of course, we will give them the information that includes the warning. They also said that these women should be aware of any risk of TTS after the receipt of J&J vaccine, and that other vaccines are available if they should choose that. So that's where we are with our J&J administration. I think I have one more slide. So what the advisory committee ultimately said was that folks that got the vaccine more than a month ago, for them, the risk is very low for getting TTS or experiencing TTS. For those who recently got the vaccine in the last 2 or 3 weeks, we just want those folks to look for symptoms, severe headaches, abdominal pain, leg pain, shortness of breath, and then contact their healthcare provider. But we do want people to continue to go to their Pfizer and Moderna appointments as planned. So I'll pause there to see if there are any J&J questions before we kind of wrap up our vaccine update.
Dr. Green, this is Dr. Kearney, and I just want to share that just late this afternoon, the Associated Press did put out a notice that a man in California was hospitalized with a blood clot after getting the J&J vaccine. So that just came out late this afternoon by the Associated Press. So I guess as new information evolved, that will be shared with the public.
Correct. And one of the pieces of information that the CDC made very clear to us, and that we want to make sure that we communicate with the public, is that our safety measures are continuing to be in place. So all vaccine providers are required to report any serious adverse effects like we would with any vaccine And one of the things I think that's really key about J&J in this instance is that, for me, it's evidence that our safety system worked and was in place. We picked up these cases out of 8 million cases or doses that were administered. The system that was in place picked up those cases. Were able to quickly identify them. They took the pause, took the time to review, and then they'll do the same with this particular case, I'm sure. They noted that to us that they're going to continue to monitor any additional cases. And as I mentioned, and we'll send out the PowerPoint to the board members that is on the CDC website. They would anticipate that there may be a few some additional cases, but ultimately that risk outweighed the benefit. Or that the benefit outweighed the risk, I'm sorry. So we will, thank you, Dr. Kearney, for that. We will continue to make sure that we watch that and get any additional updates and share that out with the public as well.
Thank you.
I want to give it some updates about what we're doing in Cumberland County. We have more than 17 providers in more than 20 different locations, and that list is growing every day. So I'm sure this list, there's probably some additional ones on here that I do not have on here, but we have widespread availability of vaccines in various locations across the county. So right now what we're seeing is that it's not the availability of the vaccine, it's the demand for vaccine. And we'll talk a little bit about how we're going to shift focus in just a moment. So on the next slide, I have our vaccine schedule. So we will continue to do second doses on Tuesdays and then first and second doses on Wednesdays. We will now, because we've seen a drop off in demand, we will take walk-ins all day long. We'll take, of course, individuals can still make an appointment, but we will continue to take walk-ins all day for folks that want one. Last Friday was our last Friday at the Crown. We are shifting toward the outreach clinic focus, and I'll talk about that in just a minute, in alignment with the state health department's kind of bring back summer campaign. But last Friday is going to be our last Friday at the Crown, and we're going to do some additional clinics there. Folks can continue to schedule online or call the phone number 910-678-7657 for assistance as well. And we continue to work with Cumberland County Community Transportation to get folks transported to the Crown. And we have folks that are on the transportation system come every clinic. So that's a positive thing. On the next slide, we've got last week, the governor announced his Bring Summer Back to North Carolina campaign. And I think it's a really great kind of cool, fun campaign that we can do to get people vaccinated. As I mentioned, we've seen a drop off in demand for vaccines. We're used to doing 900, 800, 1,000 first doses in a day, and we just have not had that level of demand, partly because we have more providers, but across the state, we've seen this big drop off in the number of people wanting to get vaccinated. And so we want to really emphasize that in order to come, to go back to a somewhat normal summer, whatever that looks like, with gathering with family and friends, we need to get more people vaccinated. And we want folks to know as part of the campaign that it is a safe, effective, and free vaccine so that we can, again, get back to those summer activities. So we have a couple of kind of exciting strategies to implement that campaign. The state health department has a toolkit online that you can use. So as soon as the toolkit was released, we immediately began to work with our PIO department to get some of those campaign materials back out. They've got posters and flyers about this Bring Back Summer initiative. We're sharing those with some of the downtown businesses, some barbershops. We're going to work with our school district to make sure our schools have those in their buildings, and those homes with parents as well. We're using some of our funding to work on some digital and TV ads for this Bring Back Summer initiative, and then also working on some radio interviews in English and in Spanish to promote vaccination. As part of that Bring Back Summer initiative, we're hitting the road. We are working on a schedule of outreach clinics. So instead of going to the Crown on Fridays, we'll be shifting that and going into other areas of the county. So for example, this Friday, we'll be at Spring Lake Rec Center to do vaccinations there. Next week, we'll be at Fayetteville Housing Authority on next Thursday, as well as we've got some second doses at Operation Inasmuch as well on Thursdays. So we're going to have a full calendar of other clinics in different locations across the county. The state health department has been really great in giving us some data about which census tracts have seen lower vaccination rates, and then we can link those to clinics in those areas. So you'll see that on Fridays, a couple of those Thursdays, and then on a few Mondays, we'll also begin to administer a vaccine at the health department on Mondays when we're not sort of on the road at our vaccination clinic. So we're really excited about that. So we want people to be on the lookout for us, and we'll have all of this information on our website as we get these different locations confirmed on the schedule. So what does vaccination effort look like in terms of the numbers in Cumberland County? We've got about 70,000, almost 71,000 residents at least partially vaccinated, which is about 21.1% of the population. About 57 have been fully vaccinated, 16.9% of the population. The governor has set a target of 2/3 of our population at least receiving one dose by June 1st. So we've got some work to do. It's important to note, though, that these numbers do not include Fort Bragg and the VA. Those are federal resources and federal assets. So those numbers are not included in the state dashboard. So we know that there's a gap there, and this is likely a pretty big undercount for the number of people that are vaccinated. But either way, we've got some work to do between now and June 1st to get folks vaccinated. Most of our vaccines have gone into the arms of females and those that are over the age of 65. So for our young people, our males, we really need them to come out and get vaccinated. If people ask me all the time, when can we take these masks off? And I say, when people get vaccinated. So in order to get there, we need people to come out to the vaccine clinic, whether that's at the health department or the hospital or elsewhere around the county, to make sure that we are serving them. On the next slide, we've got the breakdown by race. So the bars in purple are those that identify as white. The blue bars on top of those are those that identify as African Americans, and that's week over week since the vaccines have started. In Cumberland County, about 36% of our vaccines have gone into the arms of African Americans. They make up about 41% of the county. We have we're overrepresented for those that are American Indian, Alaskan Native, and Asian and Pacific Islander. So we've targeted our outreach clinics to those areas that are low income, primarily African American and Hispanic as well. So we make sure that we hit and make some improvements in other areas. And then one more data slide. This shows week over week by ethnicity for those that have at least one dose of vaccine. We've made some improvements actually over the last couple weeks since our last meeting, but of course work to do. About 5.5% of our vaccines have gone to those that identify as Hispanic. They make up about 12.1% of our population. So you heard me talk a little bit about targeting clinics for those that are Hispanic in those particular neighborhoods that have census tracts that are higher numbers of Hispanic individuals, doing some radio interviews and ads in Spanish and working with some of our Spanish language radio stations and media companies to get the word out about vaccination. So that's a lot of information about what we've got coming up. And I'll pause there for questions about anything that I said. That's all I have to report. All right, hearing none, Dr. Ojo, I will turn it back to you. And I think we lost you again, Dr. Ojo.
Can you hear me?
Okay, I think we're good. Can you try one more time? So I think you just have to mute your computer and unmute your phone. Or the other way around. Can you try talking one more time? I heard something. Can you give us a thumbs up if you can hear me? Give us 1 second.
Can you hear me now?
Okay, yes, we can hear you now. Yes, ma'am.
I'm so sorry, I don't know what is going on. But does anybody have any questions or comments for Dr. Green? Questions, comments for Dr. Green, please?
Yeah.
If not,
Yeah.
okay, Dr. Modu.
Yeah. I think Dr. Green is doing a fantastic job.
Yes, ma'am.
I'm calling to, yeah.
I think to have all the additional testing sites available is really going to help improve the lagging behind of getting the vaccine, and the fact that people in rural areas as well as in the more populated parts of the county will have greater access to those vaccine sites. So I think that's really a good idea. It's a good plan, and I think going in the right direction.
Dr. Green, I'm sorry. Dr. Green, I had a question. Have we, and previously we've had, in the COVID testing, we've had high rates of positivity in Afro-Americans. Why is that? Why is that? And two, have we seen the rates in Afro-Americans go down over time, like in the recent testing?
So actually, at the state level, they've actually seen the disparity widen just a little bit. And I will send out the dashboard. Again, I don't think we have a slide on it today, but our disparity here is actually pretty small. About 39% of our cases are among African Americans, and that's held pretty steady for us over time. Statewide, the percentage of cases among African Americans, that gap and white Americans have widened just a bit. And I, we have more testing sites, and the state health department has been really deliberate about making sure when they set up testing sites, they are in neighborhoods and areas that focus on historically marginalized populations. But of course, if you have access, you'll drive anywhere to get tested because you have that capability and the ability to do that. So we haven't seen as big of a disparity in Cumberland as we have in other parts of the state. But certainly when we try to launch new test sites, we try to think about areas where, one, there's not a test site already, but two, ones that are willing to work with us, and then three, folks where we can reach a marginalized population. And so we will continue to do that, even if that's not, even if it's our state vendor that's working with us.
And why do we think that there's a disparity in the positivity rate? Is it because of historically back that African Americans underlying health conditions are make them more susceptible?
I think there's a lot of things going on. So one, the accessibility piece. Where are the test sites? Is it open and available? The ability to, get off work, take time off. Folks also tend to work in essential worker jobs that really put you on the front line. So you're working in the grocery store where you can't maybe socially distance, or you work in a factory where everybody's really close together. So that work setting, and the same thing for your living setting. We tell people all the time to isolate and quarantine, but if you live in a one-bedroom apartment or in multi-generational households, it's really challenging to isolate from somebody. And so I think we're kind of seeing a mashup of all of those things. We still get lots of questions about the cost of testing. All of the state testing sites are free, but I think for some people that still feels like a cost barrier for them. They feel like people they'll charge insurance or bill their insurance, and the state test run sites won't do that. Some of our other testing locations will bill insurance, and so when you hear that, that's when you hear, oh, they're going to bill my insurance. I think the thought is they're going to bill me, or I have to pay an admin fee, and it's not quite free, but I don't know where the free test locations are. So I think all of those factors are certainly at play here. And then, of course, I think just some hesitancy about this is all from the government, for sure, particularly around vaccinations, I think, but around testing as well. So I think all of those things are at play here.
Thank you, ma'am.
To add to that, Dr. Green, I think also miscommunication as well. Although you all do a wonderful job in communicating from your level, there's still incorrect information that is placed out there on social media or Facebook, and all it takes is for someone to start something that's not scientifically based, and all of a sudden it just takes on a lot of followers and then gets a lot of misinformation communicated out that's not validated. And I think that has a lot to do with it as well, because I have talked with extended family members, and even though all the correct information goes out there, they somehow still tend to get information that's just totally unscientifically based. And so, that happens when you have so much information, it's getting saturated with things that are not accurate.
Absolutely. One of the things that we've really tried from the beginning is to do lots of different community presentations. Any invitation that we've got to do a community presentation, we've tried to do. So we've done presentations at churches that were virtually, that were really large churches, churches where it's just a few people on the line. community groups and agencies that have invited us so that we can get that correct information out there. And the questions that we get tell me that, yes, there is a lot of information out here, a lot of myths about how COVID is spread, or a lot of myths about it's not real, and lots of questions around that. So I agree. We hear we do a lot of correcting of misinformation.
Exactly. I totally agree.
Thank you very, very much. Any other questions for Dr. Green? Comments, please? Thank you very much, Dr. Green. Please review the attendance membership roster and communicate any discrepancies to Ms. Kelly. Do we have any comments from the board members? Any questions, comments, board members?
This is Dr. Kearney. I would like to receive those links that were mentioned earlier in reference to some of the bills that are potentially in the works of possibly being looked at, that Dr. Green had mentioned earlier.
Yes, we'll send that out. It comes in a spreadsheet, and so we'll send that out to you.
Thank you, Dr. Green. Any other comments from board members? Okay. Please save the date for the National Association of Local Boards of Health annual conference. It's from August 1 through August 3. And if you are interested, please let Ms. Kelly know. Thank you very much for attending today's meeting. Please mark your calendar for the next meeting on May 18th at 6 p.m. And if there's any item or items that you would like to be included on the next agenda, please let us know ahead of time. Thank you very much and have a great week. Be safe.
Thank you.
Thank you.
Thank you. Thank you, Dr. Ojo. Thank you.
Thank you very much. Have a nice week and be safe.